If you're on Medicare and take prescription medications, picking the wrong Part D plan is a mistake that could cost you hundreds of dollars every single month. I'm talking about overpaying by $200, $300, or even $500 monthly. In this video, I'm walking you through exactly how to choose the best Part D plan for your specific medications. We'll cover how to compare plans, the gotchas to watch out for, and the biggest enrollment mistakes I see people make. By the end, you'll know exactly which plan keeps the most money in your pocket. Medicare's annual enrollment period determines your wallet for the entire year, so let's dive in. Section 1. What is Part D and the penalty trap? First, let's clarify what Medicare Part D is. It is optional prescription drug coverage offered by private insurance companies. But here is the catch. If you don't enroll when you're first eligible, you face a permanent penalty. The penalty is 1% of the national base beneficiary premium for every month you delayed. If you wait 3 years, that's a 36% penalty added to your premium forever. On a standard premium, that's roughly $150 a year in penalties alone. Even if you take 0 medications right now, you should enroll in the cheapest Part D plan available. Think of it as insurance against future penalties. You can always switch plans later during annual enrollment if your health changes. Key dates. Annual enrollment runs from October 15th to December 7th. Your choice takes effect January 1st. Missing this window means you are stuck with your current coverage for another full year. Section 2. How costs work, the 4 phases. Understanding the structure of Part D is the secret to saving money. There are 4 phases of coverage. The deductible. You pay 100% of costs until you hit the deductible limit, up to $545 in 2025. Initial coverage. You pay a copay or coinsurance. The plan pays the rest. You stay here until total drug costs reach $50–30. The coverage gap, donut hole. In 2025, you pay 25% of the cost for brand name and generic drugs until your out-of-pocket spend hits $8,000. Catastrophic coverage. Once you've spent $8,000 out of pocket, you pay very little for the rest of the year, usually capped at small copays or 5%. The takeaway, don't just look at the monthly premium. A $15 month plan might look cheap, but if it has high copays for your specific drugs, you could spend thousands more than a $60 month plan with better coverage. Section 3. How to compare plans step by step. Here is the exact method to compare plans using the official tool. Step 1. Go to Medicare.gov and click Find Health and Drug Plans. Enter your zip code. Step 2. Enter all your medications. This is critical. Do not guess. Grab your pill bottles and enter the exact name, dosage, and frequency, e.g., lisinopril 10 mg once daily. If you skip this, the cost estimates will be wrong. Step 3. Select your pharmacies. Prices vary by pharmacy. Include your favorite local spot, but also check major chains or mail-order options to see if they are cheaper. Step 4. Review results by total yearly cost. Medicare ranks plans by premium plus drug costs. This is the only number that matters. Step 5. Click into the top 3 plans. Check if your drugs are subject to restrictions like prior authorization or quantity limits. Section 4. The 5 biggest mistakes. Avoid these common traps. Choosing based on premium alone. A low premium often hides high deductibles and copays. Always look at the total yearly cost. Not checking the formulary. Formularies, drug lists change annually. Ensure your specific drugs are still covered and haven't been moved to a more expensive tier. Ignoring pharmacy networks. Some plans penalize you for using out-of-network pharmacies. Always check preferred networks. Set it and forget it. Never auto-renew without checking. Plans change prices and coverage every year. You must compare every October. Forgetting mail order. 90-day mail order supplies are often significantly cheaper than retail pickup. Section 5. Special situations and financial help. Extra help, low-income subsidy. If your income is limited, approximately $22,000 for singles, $30,000 for couples. Apply for extra help at socialsecurity.gov. It can reduce premiums and copays to almost zero. Medicare Advantage. If you have an Advantage plan, drug coverage is bundled. Use enrollment time to check if a different Advantage plan covers your specific meds better. Creditable coverage. If you have employer coverage that is creditable, as good as Medicare, you don't need Part D yet and won't be penalized later. Get proof of this in writing. Section 6. A real-world example, the Margaret case. Let's look at Margaret, a 68-year-old taking 4 common meds: atorvastatin, metformin, lisinopril, levothyroxine. Plan A. $0 monthly premium. Sounds perfect, right? But 3 of her meds are in Tier 4 high cost. Total yearly cost, $2,800. Plan B, $45 monthly premium. Sounds expensive, but her meds are Tier 1 low cost. Total yearly cost, $1,200. By paying the higher premium, Margaret actually saves $1,600 a year. This proves why you must look at the total cost, not just the monthly fee. Section 7. Your action plan. Here is your checklist to execute immediately. Gather info. Get your exact medication list, names, dosages. Use the tool, go to medicare.gov. Plan compare. Sort by total cost. Ignore the premium. Look at the total estimated yearly cost. Check the details. Verify the formulary and pharmacy network. Enroll. Complete the switch online or by calling 1-800-MEDICARE before December 7th. Choosing the right plan isn't complicated if you do the homework. Don't rely on your neighbor's advice. Your medications are unique to you. I've linked a free Part D comparison worksheet in the description to help you track this easily. If this saved you money or cleared up the confusion, hit that like button and subscribe to Medicare Clarity for Seniors. Drop a comment below with your questions. I read them all. Thanks for watching, and I'll see you in the next video where we tackle Medicare Advantage versus Original Medicare.